You've probably heard people throw around the term OCD quite loosely. We hear about it all the time and often see it in movies and TV shows. But what is OCD? OCD stands for Obsessive Compulsive Disorder and is a serious anxiety disorder. And despite how often we hear about it, it only affects about 1% of the population during any given year. And like its name says, the characteristic traits of OCD are experiencing frequent obsessive thoughts and compulsive behaviors. Obsessions are unwanted thoughts, images, or urges that repeatedly come into the person's mind. These thoughts can lead to anxiety, which leads to the second part of the disorder, compulsions. Compulsions are acts that the person feels they need to do in order to relieve the anxiety that was created by the obsessions. For example, someone with an obsessive fear of germs may have the compulsion to wash their hands over and over again, or they may have to use a switch an even number of times, or say a certain word. This can have a massive impact on someone's daily life, as the rituals can take several hours each day. People with OCD often know that their obsessions and compulsions are not logical, but they feel it is out of their control. Luckily, there are some treatment options. The two main treatment options are psychological therapy and medication. Psychological therapy is usually a special type of cognitive behavior therapy, CBT, that is known as exposure and response prevention, ERP. This method involves gradually exposing you to your fears or obsessions, without you then engaging in compulsions. For example, someone with OCD might have the obsession that they forgot to turn the iron off, and so the house will burn down. They might then go into a ritualistic compulsion of checking the iron several times to make sure that it is off, and depending on the severity of the OCD, this could take up a large amount of time. With ERP, the patient acknowledges their obsessions and then resists the compulsion. It is a very simple method, but can be very difficult for sufferers of OCD, so it's best to start with compulsions that are not too strong and build over time. The cause of OCD has been linked to serotonin, so the main form of medication used are selective serotonin reuptake inhibitors, SSRIs, a type of antidepressant. These are some of the common medications used. However, your doctor may prescribe other antidepressants and psychiatric medications. Whereas psychological therapy may have an effect very quickly, it can take up to 12 weeks to notice the effects of medications. As with most medications, there is a possibility of side effects. For SSRIs, some of the possible side effects are feeling agitated or anxious, feeling sick, having problems sleeping, and headaches. There's also a very small chance that SSRIs can cause people to have suicidal thoughts or want to self-harm, so it's very important to contact your doctor or go to the hospital if this happens. Finally, you should never stop taking SSRIs without speaking to your doctor first, as this can have some very unpleasant side effects. We are not sure what the exact causes of OCD are, but we do know that you're more likely to develop OCD if someone in your family has the disorder. It's also been noted that some OCD sufferers have different brain structures and activity, in particular low levels of serotonin. OCD is more common in those that have experienced traumatic life events such as bullying, neglect, or abuse. Thank you for watching today's video. I hope you know a little bit more about OCD now. Leave a like and subscribe if you enjoyed the topic, and if you have any questions, let me know in the comment section below. And as always, I hope you have a fantastic day.